Hello, my name is Monica Bailey, and I am joined by Lois Wayema, Katie Robb, and Frank Stickler. This is our presentation on Faye Abdellah's 21 nursing problems. We chose this nursing theory due to its widely applicable and holistic nature.
Biography. Faye Abdellah was born on March 13, 1919. She graduated from Fitkin Memorial Hospital Nursing School in New Jersey in 1942. Abdellah was the first nurse officer to earn the ranking of a two-star rear admiral and was the first nurse and woman to serve as deputy surgeon general. Abdellah is known to be one of the pioneers of nursing research, and she developed her 21 nursing problems theory in 1960. This theory is considered a human needs theory, and it is geared to educate nurses and guide care in hospitals, but it can also be applied in community settings. Abdellah is known for many publications such as Better Nursing Care Through Nursing Research and Patient-Centered Approaches to Nursing. Abdellah also developed educational materials on sensitive areas of public health such as AIDS, hospice care, and drug addiction. Abdellah's work changed the focus of nursing from disease-centered care to patient-centered care, and she began to include the care of families and the elderly in nursing care. The patient assessment of care evaluation developed by Abdellah is now the standard used in the United States today. Faye Abdellah was inducted into the National Women's Hall of Fame in 2000, and she passed away in February 2017 at the ripe age of 97.
Hi everyone, I am going to talk about the explanation of theory. So Faye Abdallah's 21 nursing problem theory is an extension of Henderson's 14 basic human needs. Along with that, it was developed with the help of Maslow's hierarchy of needs and Erikson's developmental theory. Faye Abdellah formulated this scientific theory to differentiate between the nursing model and medical model of nursing education. According to Maharin et al. In 2020, Abdellah identified 21 problems to maintain physical, psychological, and social balances of patients. The needs of patients are divided into 4 categories of physiologic, safety, love and belonging, and self-actualization. Maharin also explains that this theory is a patient-centered theory in which nurses have a key role in identifying and solving problems. The nurse is expected to help patients meet their needs through problem solving. The 21 nursing problems are as follows: to maintain good hygiene and physical comfort, to promote optimal activity, exercise, rest, and sleep, to promote safety by preventing accidents, injuries, and other trauma and preventing the spread of infection, to maintain good body mechanics and prevent and correct the deformity, to facilitate the maintenance of a supply of oxygen to all body cells, to facilitate the maintenance of nutrition for all body cells, to facilitate the maintenance of elimination, to facilitate the maintenance of fluid and electrolyte balance, to recognize the physiologic responses of the body to disease conditions, pathologic, physiologic, and compensatory, to facilitate the maintenance of regulatory mechanisms and functions, to facilitate the maintenance of sensory function, to identify and accept positive and negative expressions, feelings, and reactions, to identify and accept interrelatedness of emotions and organic illness, to facilitate the maintenance of effective verbal and nonverbal communication, to promote the development of productive interpersonal relationships, to facilitate progress toward achievement in personal spiritual goals, to create or maintain a therapeutic environment, to facilitate awareness of self as an individual with varying physical, emotional, and developmental needs, to accept the optimum possible goals in the light of limitations, physical and emotional, to use community resources as an aid in resolving problems that arise from an illness, and to understand the role of social problems as influencing factors in the cause of an illness.
To properly display the use of Abdellah's 21 nursing problems, I referred to a population I know well from my time as a critical care nurse. Post-ischemic stroke patients require heavy interdisciplinary care and carefully planned interventions to give them a chance at optimal outcomes, making them the perfect population for application of this theory. This model assumes that shared decision-making will take place with the patient, power of attorney, or proxy. The high incidence of altered mental status in stroke patients only further emphasizes the importance of identifying a decision maker who will act in the patient's best interest. So going into the case study and addressing problem 1, to facilitate good hygiene, daily baths with chlorhexidine, soap, and dimethicone-based lotion should be used. Linen should be changed daily and as needed if soiled. Proper hygiene includes frequent incontinence and skin checks, as many stroke patients will suffer loss of sensory and motor control. Wound care should be implemented when needed. Pain management is imperative to maintaining the patient's comfort and should be frequently assessed and individualized to patient needs. Looking at problem 2, to promote balance of rest versus activity, measures to reduce ICU background noise such as closing doors when medically safe should be implemented. It is important to cluster the patient's activities, including nursing tasks such as bathing and ambulation, so that the patient has adequate rest periods and less interruption during their sleep hours. Now looking at problems 3 and 4, due to potential changes in motor and sensory function, these patients are at a very high fall risk. To promote safety, fall precautions such as low bed height, fall alarms, non-skid socks, and proper DME during ambulation can be used. Early intervention with physical therapy and occupational therapy is helpful to establish the patient's new mobility baseline and create the appropriate plan of care. Even if they are done passively, frequent range of motion exercises can help prevent deformities. To prevent infections, invasive access such as central venous catheters, Foley catheters, and endotracheal tubes should be removed as soon as medically appropriate. Now, addressing problem 5. Adequate oxygenation is especially important to these patients. Their already compromised neurological function is subject to further deterioration without it. Monitoring should include continuous pulse oximetry and arterial blood gases. Arterial lines are an effective way to monitor hemodynamics and obtain frequent blood gases. Supplemental oxygen, and in severe cases, endotracheal intubation with mechanical ventilation can be used to properly oxygenate the patient. NIH stroke scale assessments should be done at regular intervals per facility protocol to catch further decline and implement early intervention if needed. Addressing problem 6, after a stroke, a patient's ability to safely swallow can never be assumed. Many patients experience silent aspiration after a stroke. A speech-language pathologist should evaluate the patient's swallowing as soon as possible so proper diet modifications can be made. Interventions such as thickened liquids or insertion of an NG tube for nutrition supplementation may be required. Addressing problem 7, stroke patients are at a very high risk of constipation in the ICU due to decreased mobility and dehydration when swallowing abilities are compromised. Proper elimination can be promoted through a scheduled and as-needed bowel regimen, including Senna, Miralax, Milk of Mag, lactulose, and bisacodyl suppositories. For patients with urinary incontinence and retention, a toileting schedule can be helpful to retrain the bladder. Addressing problem 8. Daily and as-needed labs, including a BMP and CBCs, should be collected to monitor fluid and electrolyte balance. Potassium, magnesium, and other common electrolytes can be supplemented by mouth or intravenously if needed. Intake and output are traditionally monitored hourly on these patients, especially in the first few days after the stroke. Now looking at problems 9 and 10, ICU delirium is one of the most common issues that ICU patients will face, and altered mental status that often accompanies a stroke can make these patients more vulnerable to the development of delirium. Frequent reorientation and redirection can be used as a first-hand intervention to both prevent and treat delirium. However, many delirium patients develop agitation and benefit from pharmacologic interventions such as Seroquel. Escalation to medication should only be used, however, if the patient is no longer redirectable without it. Addressing problem 11, Early intervention from physical and occupational therapy gives stroke patients the best chance to maintain and improve their sensory function. Individualized plans of care that accommodate sensory deficits should be implemented to keep patients safe and promote their success. Addressing problems 12 and 13. Due to the major deficit in function a stroke can cause, these patients are often grieving the loss of their independence. Nurses should actively listen and provide emotional support to facilitate this grieving process and help patients and caregivers adapt to their new lives. This includes identifying and never assuming how patients and caregivers perceive the illness and how they wish to be treated. Long-term, psychotherapy for both patients and caregivers can be helpful. Now, if we look at problem 14, communication deficits such as expressive, receptive, or global aphasia are common. Identifying and accommodating communication deficits is important to ensuring successful care. It is the responsibility of the nurse and the interdisciplinary team to understand nonverbal cues of pain and other patient problems. Picture boards and other physical aids can be used to assist the patient in their communication. Looking at problem 15, all too often, providers lack competence in prognosis communication. Education should be provided to patients and caregivers in a way that is easy to understand. Health literacy levels will vary, and education needs to be adapted individually. Keep in mind that these patients and families are undergoing a stressful and life-changing event, so education and gentle reassurance is often needed. This will allow for proper informed consent and shared decision-making, two of the major goals of Abdellah's theory. Addressing problem 16, the hospital chaplain is an underutilized resource. Chaplains are patients' community spiritual leaders are an important part of the care team if spirituality and religion are valued by the patient and family. However, patients who are not religious or spiritual may still benefit from this extra support, and it is important to convey this resource is available for patients with needing emotional support as well. This part of a patient's care can facilitate hope and positive mental health. Looking at problem 17, maintaining a therapeutic environment goes beyond keeping a clean and clutter-free patient room. Nurses and APRNs should assess visitor impact. Sometimes loved ones think that they are being helpful, but the patient may be experiencing additional stress from their presence or want rest periods alone. Certain visitors may be more therapeutic than others. Nurses may need to advocate for the patient in this regard. Addressing problems 18 and 19. The nurse should lead a continuous dialogue with patients and decision makers on goals of care and important values. In the case of devastating and potentially permanent loss of function, it may be in the patient's best interest to discuss palliative care or consult the palliative care team for follow-up. Patients that are unable to advocate for themselves run the risk of having their wishes overrode by the incongruent wishes of their decision makers. APRNs and palliative care providers are essential patient advocates in these ethical dilemmas. Looking at problem 20, patients often require specialized discharge planning, and nurses should collaborate with an experienced hospital social worker to facilitate this. Due to deficits, patients may need placement in a skilled nursing facility or implementation of home health, including physical therapy. The social worker is also a good resource for referral to community programs such as stroke support groups and financial aid to help the patient and caregivers adjust to their new lives. Now, looking at our 21st and last problem, strokes rarely happen without a cause. Identifying the social precipitating factors such as smoking or diet and working with the patient and family to form a long-term preventative plan will give the patient the best chance of success going forward.
To examine this theory in the context of current practice, a literature search was performed. Using CINAHL and Google Scholar, the phrases Faye Abdellah, 21 Nursing Problems Theory, and Abdellah's Nursing Theory were entered into search. To keep the context current, a filter was applied to exclude all articles older than 2018. Only 2 journal articles resulted with the use of the theory. Marine et al. Presented a case study of a 31-year-old female with type 2 diabetes who was having GI complications after an appendectomy. This article presents excellent tools for collecting objective and subjective data from the patient encompassing all 21 problems, and presents ways to take that assessment data into the framework of the problems to create a holistic care plan for the patient. Mirzaei and Al-Shapur presented a quasi-experimental study examining the quality of life of cancer patients. Patients were divided into a control group and an intervention group, with the intervention group being treated with a care plan using Abdellah's 21 nursing problems as a framework. The intervention group showed significant improvement in questionnaire items related to quality of life than the control group, with a p-value of less than 0.001. It was then discussed that patients in chronic and terminal illness programs that do not address quality of life in a holistic manner risk having worsening quality of life as their disease progresses. It should be noted that outside of the 2 journal articles found, Google Scholar presented 5 doctoral dissertations from DNP and PhD nursing students. Projects ranged from unit-based interventions to utilization of the theoretical framework in the education of pre-licensure nurses. This indicates a likely increase in journal articles utilizing the theory as these nurses begin to publish their own work independently.
This theory can be used by APRNs and nurses in various practice fields because it has the ability to improve holistic patient care and prevent further health problems through shared decision-making, interdisciplinary collaboration, and patient education. Due to the lack in volume of current studies, further exploration is needed on the application of this theory in practice. This is the conclusion of our presentation on Faye Abdellah's 21 nursing problems. Below is our references.